Good morning everyone. I shall be talking about a case of an adverse reaction of lignocaine, not because it's something very extraordinary, but this sort of adverse reaction can be really very troublesome for not only the patients but for the surgeons as well. To begin with, few fundamentals of lignocaine. It's an amino-acyl amide. On injection, it acts on the fast voltage gated sodium channels, alters the signal propagation, therefore the postsynaptic neurons do not depolarize and therefore the action potential is not transmitted. To begin with our case, we have a 27-year-old male who presented with watering from both eyes and on examination was found to have bilateral punctal stenosis. So we plan to do a bilateral punctal snip and the patient underwent the procedure. Under 2% percutaneous lignocaine, 1.5 ml at each side was injected to block the infratrochlear and the infraorbital nerve. He was examined at day 1 and 7 and the patient was doing all right. But at 1 month he came to us with complaints of blackish discoloration as a black arrows point at the sites of the injection. And as we can see, there was localized hyperpigmentation which was mildly inflamed with very well defined margins. So we prescribed the patient on topical steroid ointment and topical kojic acid ointment both once daily and called him after a month. So now the patient has come after 1 month and we can see the red arrows point towards hyperpigmentation with little diffuse margin. Now the inflammation subsided and the intensity of hyperpigmentation has remained the same. So we asked him to continue kojic acid ointment for 1 month, stop the steroid and called him after 1 month. Patient was lost to follow-up, came to us after 4 months and now we can see the pigmentation has become really diffuse to the extent that the entire periocular skin now looks black. We referred to a dermatologist and the patient later benefited somewhat with chemical peel and laser ablative resurfacing. A quick glance at the literature, not many available, but Dr. Savita Yadav et al. Reported a case of this sort of streaky hypopigmentation in a patient after periangle wart excision under lignocaine anesthesia. I have cited 2 other articles where there is evidence of petechial and purpuric eruption after application of EMLA and prilocaine cream. So what is a drug-induced hyperpigmentation? Any pigmentation temporarily associated with a drug use where all other potential causes have been ruled out. The etiopathogenesis suggests deposition of melanin under the dermal macrophages which can be direct trigger from the drug or can be due to some non-specific inflammation. And there are also evidences which suggest that the drug itself can get deposited under the dermal macrophages causing this sort of effect. It has been seen to get worsened by exposure to UV and sun rays and there are also evidences which suggest deposition of toxic chemicals released by the drug in the blood vessels and also iron in the blood vessels which cause lysis of the blood vessels causing pigmentary disturbance. So coming to our case, the pigmentation was initially very localized which later became diffuse. So this kind of indicates the spread of the drug through the facial lymphatics which might have some unrecognized interaction on the ion channels of the melanocyte cells causing this sort of hyperpigmentation. So the take-home message from this case is whenever we are dealing with such sort of adverse reaction of drug, it's advisable to deal little aggressively and to sought for other specialty intervention at the earliest, like in this case a dermatologist intervention. And why is this case worth a discussion? Because definitely because of the rarity of this sort of adverse reaction, and second, lignocaine is rampantly used in various sort of oculofacial as well as aesthetic procedures. So this sort of adverse reaction can be really very aesthetically unpleasing. So it will be really very interesting to study the action of lignocaine on melanocyte cells in vitro models as well as in animal models, and also to see whether there is any genetic predisposition that might lead to the pigmentary disturbances following lignocaine. These are my preferences. Thank you.
Any relation to the dose and this side?
Ma'am, as we saw the literature and also in our case, we don't, all of these were very minor surgical procedures or aesthetic procedure, so the dose was really less. So in our case, like it's 1.5 ml at each sides of the nerve block on